Today's video topic is dehydration. Dehydration is a condition that occurs when your body loses more fluids than it takes in. This might sound simple, but water is a vital component of nearly every single process happening inside us. In fact, 60% of the human body is composed of water. From regulating body temperature to aiding in digestion and even lubricating joints, water is like the unsung hero of bodily functions. When we don't get enough of it, things can go a bit haywire. At its core, dehydration happens when the body's water levels drop below the necessary threshold to maintain normal physiological operations. This can be caused by several factors, which we will explore in detail. Normally, we lose water through processes like sweating, urination, breathing, and even through tears and saliva. Under normal circumstances, this loss is balanced by fluid intake through drinking and eating water-rich foods. However, when the balance tips and the loss outpaces intake, dehydration sets in. Causes of dehydration. There are several reasons why your body might not have enough fluids. One of the most common causes is not drinking enough water. This can happen if you're too busy, forget to hydrate, or simply don't feel thirsty. Older adults are particularly at risk since their sense of thirst diminishes with age, making them less likely to drink sufficient amounts of water. But dehydration isn't just about not drinking enough water. It can also happen if you lose too much fluid. This can occur in various scenarios. Sweating, especially during intense exercise or in hot and humid conditions, leads to considerable fluid loss. Fever is another culprit. When your body temperature rises, you sweat more, losing fluids in the process. Diarrhea and vomiting are particularly problematic, as they can result in rapid and significant fluid and electrolyte loss. If these conditions are severe or prolonged, they can be especially dangerous. Additionally, certain medications can also play a role. Diuretics, often prescribed for high blood pressure, increase urination and can contribute to dehydration. Similarly, laxatives and certain other medications can have a dehydrating effect. Another sneaky cause of dehydration is alcohol consumption. This is because alcohol acts as a diuretic, meaning it makes you pee more, and that can lead to losing more fluids than you're taking in. Finally, medical conditions also play a role. For instance, high blood sugar levels in diabetes can lead to increased urination, contributing to dehydration. Kidney disorders, which affect the body's ability to balance fluids, can also lead to dehydration. Finally, burns and other severe skin injuries can cause fluid loss through damaged skin, further complicating hydration status. Symptoms of dehydration. The symptoms of dehydration can vary from mild to severe, depending on how much fluid your body is lacking. In the early stages, you might feel thirsty. This is your body's way of telling you to drink up. But thirst isn't the only sign. You might also notice that your mouth feels dry and sticky, and you might have a reduced need to go to the bathroom. When you do pee, your urine might be darker than usual, and you might not go as often as you typically do. Fatigue or lightheadedness can also occur because your body requires water to perform essential functions, and dehydration can lead to a drop in blood pressure. As dehydration progresses, the symptoms can become more pronounced. You might start to feel really dizzy or lightheaded, and you could experience a headache. Your skin might feel dry and cool to the touch, and you might even feel tired or weak. In severe cases, dehydration can cause rapid heartbeat and breathing, sunken eyes, and confusion. Blood pressure may also drop significantly, leading to fainting or even shock. Confusion, irritability, or unconsciousness can also result from severe dehydration affecting brain function. If it gets to this point, it's a medical emergency and you should seek help immediately. You might now wonder, how do I know if I'm dehydrated? Well, the best way to find out is to see a doctor who can check your vital signs and do some tests, which we will explain in a minute. But if you can't get to a doctor right away, there are some things you can do at home to get an idea of how dehydrated you are. One simple test is to pinch the skin on the back of your hand and pull it up slightly. Then let it go and see how fast it snaps back into place. If your skin is elastic and goes back quickly, you're probably well hydrated. But if your skin is slow to return or stays tented, you might be dehydrated. This is because dehydration reduces the amount of fluid in your skin cells, making them less flexible. Another test is to look at the color of your urine. Usually, urine should be pale yellow or clear, indicating that your kidneys are working well and flushing out waste. But if your urine is dark yellow, brown, or orange, it means that your body is conserving water and your urine is more concentrated. This can also cause a strong odor and sometimes pain or burning when you pee. These tests are not foolproof, though, and they don't tell you how severe your dehydration is. So, if you have any symptoms of dehydration, such as thirst, dry mouth, fatigue, dizziness, headache, or muscle cramps, you should drink plenty of fluids and seek medical attention if they don't improve. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of dehydration. Diagnosing dehydration involves a combination of evaluating symptoms, a physical examination, and sometimes laboratory tests. Your doctor will first inquire about your symptoms and medical history, asking questions about fluid intake, urination patterns, recent illnesses like vomiting or diarrhea, and other relevant factors. A physical examination provides additional clues, so your doctor will check for signs such as dry mouth, sunken eyes, reduced skin elasticity, and low blood pressure. They may also monitor vital signs like heart rate, blood pressure, and respiratory rate, which can help determine the severity of dehydration. Urine tests can provide valuable information, revealing how concentrated your urine is. Blood tests may also be conducted to assess electrolyte levels and kidney function, with elevated levels of blood urea nitrogen and creatinine, indicating dehydration and impaired kidney function. Treatment of dehydration. Treating dehydration depends on its severity and the underlying cause, with the primary goal being to restore the body's fluid balance and address any contributing factors. For mild to moderate dehydration, the simplest and most effective treatment is drinking fluids. Water is usually sufficient, but oral rehydration solutions can be particularly helpful, especially if dehydration is due to vomiting or diarrhea. Oral rehydration solutions contains a balanced mix of electrolytes and sugars to help replenish lost fluids and minerals. Clear fluids like broth, diluted fruit juices, and sports drinks can also aid in rehydration, although it is important to avoid caffeinated or alcoholic beverages as they can exacerbate dehydration. Eating water-rich foods such as fruits and vegetables can also help increase fluid intake. In cases of severe dehydration, prompt medical attention is necessary. Oral rehydration might not be sufficient and intravenous fluids may be required. Intravenous fluids provide a direct and rapid way to restore fluid balance and electrolytes, particularly important if the patient is unable to drink due to nausea, vomiting, or unconsciousness. Severe cases might necessitate hospitalization for close monitoring and treatment, especially for vulnerable populations such as young children, older adults, and individuals with underlying health conditions. Prevention of dehydration. Preventing dehydration is crucial and involves several proactive steps. Staying hydrated by drinking plenty of fluids throughout the day is essential, even if you do not feel thirsty. The recommended daily water intake varies, but a general guideline is to drink at least 8 cups, 64 ounces, of water daily. Although individual needs can vary based on factors like age, gender, activity level, and climate. Monitoring fluid loss is also important, paying attention to how much you sweat and urinate and adjusting your fluid intake accordingly. If you are exercising or spending time in hot weather, make sure to drink extra fluids to compensate for the increased fluid loss. Incorporating water-rich foods into your diet can also help maintain hydration. Fruits like watermelon and oranges and vegetables like cucumbers and celery are excellent choices. It is important to be mindful of your intake of diuretics like caffeine and alcohol, as they can increase urine production and contribute to fluid loss. Planning ahead for situations that could lead to dehydration, such as exercising, traveling, or spending time in hot weather, is also crucial. Bring plenty of water and take breaks to rehydrate as needed. Certain groups of people are at higher risk of dehydration and need to be particularly vigilant about maintaining adequate fluid intake. Infants and young children are more susceptible, because their bodies have a higher water content and lose fluids more quickly. Ensuring they drink fluids regularly, especially during hot weather or illness, is crucial. Older adults should make a conscious effort to drink water regularly, even if they do not feel thirsty, as their sense of thirst diminishes with age. So, keep that water bottle handy, listen to your body's signals, and stay hydrated for a healthier, more vibrant life. Now, we want to hear from you. Did you or someone you know have dehydration before? What symptoms did you have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.